Ladies and gentlemen, the event is about to begin. Please welcome President and Chief Executive Officer Warner Thomas.
All right. Good morning. This is kind of like the old days, like back when I came to Oxford in 1998, and we had about 50 people on the management team. So we're here live at Baptist. So let's give a big welcome to all of our Baptist folks. We're here in their great auditorium, so we're excited to be here today, and we have an abbreviated system leadership meeting today, but we did want to give you an update of what's going on around the organization, share with you some good news, share with you kind of how we're looking at the end of the year, what we're focused on kind of going forward, and make sure we just keep everybody up to date. And we'll do our System Spirit of Leadership Awards later on, so who will it be? You never know. So you guys ready for that? All right. So I'm sure like out in the virtual like audience, they're going crazy right now. I mean, I bet they're just like doing the wave and it's like, you know, the worm on the floor. It's just, I mean, that's what I'm picturing. I think they're just going nuts out there. So we're excited for today. Let's give you a little bit of an update of some of the things we're going to do. Big welcome to everybody. We're excited to go over things. We do have a lot of our partners that are connecting with us today. I was actually at Lafayette last night. We're going to talk a little bit about Lafayette today, but big shout out to the folks at Lafayette General, our folks at Slidell Memorial, our partners there, and at St. Tammany. Yesterday we announced a new partnership with Singing River Health System in Pascagoula and Ocean Springs, Mississippi. So big welcome to our folks from Singing River. And our great partners down at Terrebonne General and Homa, and obviously Rush Health System. We're going to be meeting with those folks later on today. Rush is from Meridian, Mississippi. So let's give a big welcome to all of our partners. Excited about that. So we always like to start with a patient story, and this is an amazing story that was highlighted on Good Morning America. Actually, it's highlighted on lots of different TV stations, really nationally. So this is Juliet Daly, pediatric patient from the North Shore, had a pretty incredible experience, quite frankly. Had to be airlifted to Oxford Medical Center. She was a patient at St. Tammany Parish Hospital. Literally, Oxford saved her life, and she is, and her parents are forever indebted to us. So let's take a look at Juliet's story.
He tried to grab it from me, and I ripped. That's how I got into sewing. His stuffed animals to, quote unquote, help them, because some of them have toys, or some of them don't have enough stuffing, so I have to do stuffing translations with old
We've never done this before. This is COVID, right? So we're kind of doing this all on the fly. Sorry, AV guys are working on this, but a little bit more about Juliet's story. So she certainly had a very significant heart condition, had to be airlifted to Oxford Medical Center. Once again, she was taken care of by our great team.
He tried to grab it.
And here we go. Are we ready to roll? We're ready to roll. Let's take a look.
That's how I got into sewing. His stuffed animals to, quote unquote, help them, because some of them have toys, or some of them don't have enough stuffing, so I have to do stuffing translations with old used toys that I don't like anymore. My mom has one rule. One rule. We can't die before she dies.
Ready, set, and go.
I talked to my husband, and he said that she did not throw up again, but her color was really bad, and he said her lips were blue, and that just sent off warning alarms in my head. I was like, that's not good. They took her vitals, and her heart rate was between 40 and 45, which is extremely low. Normal is at least 60 to 100, so they immediately knew there was something wrong.
So this is Juliet's first echocardiogram when she came in the night of April 6th. And what we're looking here, this is her left ventricle, which is the main pumping chamber of the heart. And normally you want to see a really good squeeze of that ventricle. And her ventricle not only is going very slowly, but it's not squeezing very well. It's more doing a rocking motion.
They told my dad what was going on. Then my dad told me I was going on a helicopter, and they explained to me that I was going on a helicopter to another hospital so my mom could come, and I was going to be asleep.
So Juliet was taken by her parents to St. Tammany Parish Hospital, and their emergency department did an incredible job getting her stabilized and intubated and on a ventilator when they realized that she was really critically ill. And unfortunately, she did have a cardiac arrest.
One of the first things that we were going to do was going to secure her ET tube and set her up on our ventilator and get going. And it was after I set my ventilator down, I hear the doctor say, "We've lost pulse." And we started CPR on her, and next thing you know, I'm doing chest compressions on this little 12-year-old, which was crazy in itself.
And we were just watching the monitor, feeling her pulse just to make sure what we were seeing was correlating with what we were feeling, and her heart rate just wanted to keep trending down, so we kept pushing more medicine. And at one point, I just remember I put my hand on her chest and I just started praying and just asked God to let this little girl live and to let her be part of her family again.
So we very quickly realized that she had myocarditis and were highly suspicious that this was related to COVID. She was in complete heart block, which means the electricity from the top chamber of her heart wasn't communicating with the bottom chamber of her heart. Her heart was beating very slowly and the squeeze of her heart was very poor. So it really wasn't getting a whole lot of blood to the rest of her body and organs. And because of that, she was going into kidney failure and liver failure.
Juliet? Yes, Juliet.
Should I?
How are you doing?
Hi.
Hi, my name is Dana, and I'll be doing her EKG and vital signs. Great. What's her blood pressure? It's 108/56, and her pulse was 108.
One of the reasons why I love taking care of children is because children are so resilient. And Juliet came in as sick as you possibly can. And within 10 days of leaving the hospital, she's back to having her totally normal life. What is going on, Rockstar?
Wow.
Hello.
Nice jacket.
Good to see you again.
Man, your pocket's like bedazzled.
Fridays, I wear a blazer, and today happens to be Friday.
It is.
So first off, the good news that we're waiting for.
Yes.
Her echo looks incredible.
Her ejection fraction's okay?
Yes, her ejection fraction is. Do you have any other questions for me?
No.
I think you're really doing great, and it's been amazing to see how sick you were when you came in and how well you're doing right now. And I think we're all really amazed at you, and keep up the good work because your story is saving other kids' lives out there.
So Juliet, another thing that we do with air transport is that whenever we get patients or team members that are very, very special to us, we also give them our patch. So we like to give you our patches, okay?
Wow, thank you.
And those are the actual patches we wore that day.
Wow. I would like to say thank you to Oxnell and St. Tammany. They helped take care of me when I had the coronavirus, and I'd like to thank them.
Wow, what an incredible story. Really, really amazing. So our great partners at St. Tammany, thanks for the great work that they did taking care of Juliet. Thanks to our folks in Flight Care, Dr. Jake Climahone, who did a great job taking care of Juliet, and really just our Ochsner Hospital for Children. Amazing team there, and this is the power of partnership right here. So I truly believe if we hadn't had the connection between our organizations, had the information shared back and forth, had the teams working together, I really don't think we would have been able to save this young girl's life. And so it really is an indication of why these partnerships make so much sense. Big shout out to our pediatric hospital, once again ranked in U.S. News and World Report in 2 specialties, the only pediatric facility in Louisiana and Mississippi that are ranked 4 years in a row now. So they're doing amazing things, and you can see why we have great outcomes like Juliet's because of the great team that's going on here. So let's give them a big round of applause, big congrats. As I said, we were over in Singing River in Pascagoula yesterday. We signed a partnership agreement with Singing River Health System, but they're really the leading health system on the Mississippi Gulf Coast. They are A-rated by Leapfrog at both of their campuses, both in Pascagoula and Ocean Springs. They recently signed an agreement to buy the Garden Park Hospital in Gulfport from HCA, so they'll really be in 3 markets, and then we're obviously in Hancock. So we really had the opportunity to put together a nice system really along the entire Mississippi Gulf Coast. So excited to get that going. We'll start with them on July 1, and we'll be starting to move that partnership forward. Another big shout out to our partners at St. Tammany, 11 national awards, as you can see here, from health grades, including 3 in spine. So they've always done an amazing job from a quality perspective, but you can see here to get this national recognition is amazing. So big shout out to the folks at St. Tammany. Let's give them a big congrats. All right, so we've got a busy day today. We're going to cover a lot in a short period of time because we know that the attention span on video is shorter. Or actually, maybe it'll be better than when you're in the meeting. I don't know. We'll see how it goes today. So we're going to cover a lot of information. Kind of give you an update on not the new normal, the new abnormal. So we'll kind of take you through what that looks like. You're going to hear about workforce and our diversity and inclusion plan from Tracy Skiro and Deborah Grimes. And then we'll really kind of give you around the horn on what's going on with our strategy and consumer, destination, our community health and community impact. We got some exciting news there to share with you, digital, and then I'll round out with diversification and we'll wrap up. So a lot of great things going on. Do want to just give a big shout out to the whole system. I mean, if you look at the information around, expanding ICU capacity, accelerating internal testing, what we did to kind of move units around, move patients around, move patients from the South Shore to Slidell and vice versa. And then, our research team, Leo Swanee, Dr. Ebony Price Haywood, and that whole team, I think Dan Ford is in there, did a great job on some of the modeling, but predictive models, and really we were providing lots of information to the state. Rich Milani and Jonathan Wilton, the whole IO team, really built a database with the state testing data because they did not have any way to accumulate the data and look at what's happening across the state. And then certainly our virtual solutions. I think 3,500 or 3,600 virtual visits last year. We were doing about 4,000 a day there at one point. So the whole virtual team certainly ramped up. All of our providers really got on board with that. And our IT team and the telemedicine team built the infrastructure to be able to scale that pretty dramatically, virtually overnight. The other thing I got to just give, with Tracy Skiro, looking at her here, and Michelle Dodenhoff, and a lot of folks, setting up childcare like over a weekend is kind of like a crazy thing. I still can't really get my head around, like on Friday afternoon at 2 o'clock, we're like, okay, schools are closing. Said Tracy, we've got to figure out childcare. They go to work, and like by Sunday, they're like, hey, we think we got it. And we got to figure it out for Monday. I was like, okay, that's kind of crazy. So that's auctioneer speed. That's kind of what we do, and really pretty amazing to be able to stand it up that quick. So just a big thank you to everybody for what we've gone through in the past few months. And we know it's going to be a challenge going forward. We're going to make it through that, but just want to send out a big shout and a thank you. So thank you for all you guys have done and for what the whole team has done. Appreciate that. We do want to just give an update on some other things. So we have reaffirmed our rating with Standard & Poor's. Even going through kind of the shock financially of COVID, S&P has reaffirmed us at an A rating with a stable outlook, which I think is a huge testament to the team here and to the organization to be able to go through that. It's pretty amazing, quite frankly. And one of the things that we showed them, which I think is important, is that we know how to go through adversity. Auctioneer has gone through a lot, whether it goes back to Katrina and Rita and the floods in Baton Rouge and now a global pandemic. Starting to feel like kind of having bad luck. But anyway, maybe it's just we just need a challenge. We don't want to make it too easy. Got to throw a few curveballs once in a while. But we showed this to Standard & Poor's and to Moody's, and we showed them that over the past couple of decades, regardless of having these significant interruptions, Auctioneer just keeps rolling forward. The number of physicians, our partnership strategy, how we've continued to grow and develop as a system has not changed, even though we've gone through this significant adversity. And I think that's a real testament to all of you here and all of your colleagues that are out there virtually of kind of what we're doing as an organization. So I'll tell you that our strategy and our thesis about how we look at the industry and what we see coming in the future has not changed. This idea of having a distributed network of ambulatory sites, of hospitals, and covering a broad geographic region is still, we believe, the right thing to be doing. And that coupled with a very robust digital strategy, which got tested over the last 3 to 4 months, and will really position us to grow and develop that further. We think this is really directionally the right place to be going. And so you will not see a change in our strategy or our direction of what we're doing. You will see us probably change a few things around capital allocation. We may accelerate some projects, slow some others down, but as far as our global direction about where we're going, that's not going to change. So I think we want to create a little clarity about where we're going from here. And I just was actually looking at my picture in the little confidence monitor here. So just so everybody out there knows, everybody here is wearing a mask. I'm not wearing a mask when I'm presenting, and neither will the other presenters, but everybody else is wearing a mask. So if you they start to send nasty grams like, why don't you have a mask on, all that. We're all wearing masks except we're socially distanced. I'm probably about 20 feet away from anybody that's near me. So for anybody out there in virtual world, that's kind of what's going on here. So let's give you a little bit of update kind of where we see things going. You know, certainly lots of uncertainty, lots of challenge. With this escalation of cases now, I think there's more anxiety about what's going to happen. And so the question is, how do we create certainty about where we're going? And we know that COVID-19 is going to have long-term impacts. We do not look at this as kind of a short-term situation. And lots of organizations have dealt differently with it. We took the position we don't want to have furloughs, we don't want to have layoffs. That's really our position. We did go through the GPT reduction and having people take vacation. We're hopeful that that is going to be kind of what works, and we'll see the second half of the year our business continue to come back and see folks coming back. But at the same time, it's a very uncertain situation. So this idea of how we basically go from point to point. We get new information every week, every month, every quarter. And with that, we're going to have to modify and change. I'll tell you, in 1 month, we'll know a few things. There's a big Medicaid policy sitting before the state. We'll probably know if it passes or not. We'll know what our next wave of hotspot funding is. We'll have 4 more weeks of data about our people continuing to come back or not come back. We'll know if cases are going to keep escalating or are they going to escalate and then flatten out. We're going to know a lot more in 4 weeks than we know today. So we may make some different decisions in 4 weeks than we're making today. Or we may make different decisions 4 weeks from then or 4 weeks from then. So this is not a situation where we can't plan necessarily 3 to 5 years. We have to have a long-term direction, but we have to also understand that it's a very fluid environment and things are going to change. Some of the big assumptions we make are this. One, we don't think the government will shut the country down again. We do think there'll be spots that maybe get shut down, but we do not see a big shutdown. We think this is a multi-year issue for Louisiana and specifically for New Orleans, given the focus on hospitality and tourism. We think it's going to be a longer road in southeast Louisiana than it probably is in other parts of the country, quite frankly. So we can't look at this as what happens over the next 3 months or what happens over the next 4 months. We think this is probably an 18 to 24 month or more situation that we have to go through. So that's kind of how we have to think about planning. At the same time, we do not think there'll be a major spike as we go into the fall. We think with enhanced testing that we have today, we think if people actually do take personal responsibility and quarantine when they're sick, don't go to work when they're sick, don't go to the grocery store when they're sick, don't go anywhere when they're sick, then we'll be able to kind of tamp down any sort of escalation or spread. So these are some of the things that we're focused on. We also think that we're not sure what our new normal will be for volume coming to our organization. We don't know if we're going to continue to escalate and then stop. We don't know if it's going to continue to grow beyond that. We just don't know. We do know there's probably going to continue to be job loss, more folks leaving commercial insurance going to Medicaid, a slow ramp up of people coming back into the workforce, and that's going to challenge our revenue mix going forward, which is going to focus us to be maximally flexible. So the things we'll focus on for the rest of the year are this. And you'll hear more about this today, but we got to keep focused on quality and safety and our customer experience. So we're going to modify some of our goals around that, but you'll see kind of our goals for the second half of the year. We need to focus on how we continue to connect with patients, have them understand it's safe to come back to our organization, and continue to ramp services back up. You know, if you look at our surgical volume, it's probably in the low 80s. If you look at our clinic, we were about 90% last week. Inpatients probably about 80, but it depends on, it's different in New Orleans versus the North Shore versus Shreveport. So we have to be flexible around that. We have to make sure we focus on optimizing all the federal support we can get. So that's going to be a big focus for our teams going forward. And then really, we are going to focus on how we connect with the public health area to do everything we can to prevent a second spike and to tamp down any sort of escalation of cases. And finally, two things. We've got to adjust to a new revenue base. We don't know what that's going to be, but we'll continue to be very, very focused on cost, and we only want to add the people that we need. I don't want to be in a situation where we add too many folks and we have to go through any sort of layoff or furlough. I'd rather control the people that join us and not have as many people join us, and make sure we really focus on that and not have to kind of grow too much and then have to let folks go. That's really just not what we want to do. And then finally, you're going to hear about our digital capabilities today, how we grow those. So we will continue to think about how we change our planning and how we move quicker. We'll go to more kind of quarterly planning versus year-to-year planning. And we have to focus on this idea of how do we play defense, which is about day-to-day, how do we do the things we need to do to make things safe, to make employees feel safe, to work on engagement and work on service day-to-day, and play offense, which are things like, our partnership we announced yesterday with Singing River, and as well as last night we got the final affirmative vote from Lafayette General to complete the merger, to have Lafayette General merge with Oxford, to create really a statewide organization that's even stronger than we are today. So these are things that we have to keep doing to position ourselves long term while we're focused on essentially playing defense and doing everything day to day. So our strategy will not change. All the things we've talked about are going to go forward. Some of the things that we maybe talked about 4, 5, 6 months ago, we may dial back and slow down a little bit. But the things we will focus on, you will see a lot more focus on diversity and inclusion. You're going to hear about that plan today. A lot of work's gone into that. I think Deborah's on probably like day 125 or 126. So she was fortunate enough to come like 1 week before COVID. So I'd be walking down the hall going, we're going to be working on that. We just got to take care of this pandemic right now. But a lot of work's been done the last 3 months around that. You're going to see a lot more work on our destination and expansion of things like cancer services with our expansion to the North Shore, and you'll hear more about that. And then finally, things like how do we continue to align payments? We are going to figure out how we get more integrated on the insurance side, so that's a big focus for us over the next several months and through the rest of 2020. And then finally, digital. I mean, that will be growing and expanding, more resources there, more expansion, looking to go more regional and national around digital. And finally, diversification. We want to grow more along the I-10 corridor east. You'll see us look at more opportunities throughout the region, and certainly we want to really focus on our merger with Lafayette General and make sure that goes extremely well. So these are some of the strategic things that we think about. Many of these we've been planning. You'll see, some of the capital we may have dialed back. We did, dial back about $75 million this year. We're really thinking right now about what capital looks like for 2021. But we're not going to know for a while because we got to kind of see what happens with the market and where things go. But I do want to leave you with just kind of a couple things to think about as you're going through the challenging times. And, it is hard to go through, this, frankly, a really uncertain situation. And the real challenge is how do you manage to go through this? How do you be a leader that people want to follow? And I think I'll leave you with a couple of things. One, you've got to manage yourself. You have to understand that this is a marathon, not a sprint. That we're going to be having this probably relatively similar conversation in October and November that we're having today. And that it's not, we're just not going to wake up in 30 days and it's going to miraculously be over. That's just not the situation. So how you put yourself in the right mental mind frame around that, how you take care of yourself to find the right energy, whatever it is for you, going for walks, meditating, swimming, biking, whatever works for you, reading, gardening, whatever works for you, you've got to make sure you take care of yourself and try to avoid burnout. And I think probably all of us, having gone through what we've gone through in the last 3 or 4 months and the intensity of working in healthcare, we're probably all, frankly, a little burned out right now. So trying to take time off when you can. And I've actually received a lot of feedback from folks saying, I'm actually so glad you forced us to take some vacation time, because actually I think at the end of the day it was actually good for me, and I would not have done it had I not really been forced to do it. So maybe there was a double benefit to that at the end of the day. The second thing is prioritization. Control what you can control. Don't worry about the things that you can't control. we can't control whether there's going to be a vaccine or not. We have to control the things that we can do day to day. We can be in trials and things like that, and our research people are working on that. But that's not necessarily something I'm going to be able to control. But you've got to basically create certainty and say, this is what I know, and this is what I can educate people about what's going on in our apartment, and this is what I don't know. And I think that the idea around creating that certainty and communicating a lot with your people about that is really, really important. You can't do all this work yourself. You have to basically prioritize and help set direction. Taking risk. We made some decisions over the past 3 or 4 months that weren't the best decision, and then we had to change and do something different. But if you don't make any decisions, that's not good either. So making a decision, adjusting 30 days later because you got more information or new information. We did the famed GPT plan, which Tracy, are you going to talk about GPT today? Because it's such an amazing topic. I mean, should we do more open forums on it or something? Just kidding. We're just amongst friends here, right? So we had to change that. We made some mistakes with it. We modified it, and that's okay. We own that, and because we had new information when we got 2, 3, 4 weeks into it. So that's going to happen, and it's okay. The issue is you got to have the courage to say, okay, got new information, made a mistake here, we're going to adjust and move on, and not just kind of stay going, doing what you know doesn't make sense. So this idea of failing fast, or probably more importantly, being willing to modify and adjust. It's not necessarily being reactive and change your mind. It's adapting based on having new information. And you'll have new information 4 weeks from now and 2 weeks from now versus what you have today. Communication. I get asked a lot, like, well, how does Oxford respond to crisis? Seems like you guys have gone through a lot. I think one of the things we do really well is communication. And I think one of the things you need to make sure you master in your own area is communication. How do you talk to your people? How do you keep them up to date? How do you understand what's on their mind? Are you doing listening sessions with them? We've done a lot of listening sessions around racial inequities and discrimination and whatnot over the past few weeks, but wouldn't it be great if we just did listening sessions in general all the time? Like, what's on people's minds? What are they worried about? What are they thinking? How can we be helpful? I mean, there's such a treasure trove of information in all of our teammates that if we could just be talking to them more, I think it's a real benefit. So think about that when you go to communicate and have interactions with your team. And then finally, optimism. Nobody wants to follow a pessimist. Nobody wants to, do you want Eeyore to be your manager? Probably not, right? We're never going to make it. Now, just being blindly optimistic is not great either. Just saying, hey, it's always going to be great. The roof's falling in, everything's on fire. It's going to be amazing. It's going to be a great day. No, it's a pretty bad day, right? So you got to be realistic and optimistic around the things that you think we can move forward. But pessimistic all the time doesn't work. And I think it's hard sometimes when we go through all this to not be pessimistic. But I would challenge you to look for the silver lining. Look for the opportunity. Look for the great things that are happening. Share that. Avoid this victim mentality of, why is this happening to us? Why do we go through this? I can't believe this is happening. You're all going to have those moments. We all have them. Try to keep them private. Try to do it with your close colleagues. But when you're out there leading and being in front of people, you got to be an optimist around where we're going, and you got to be realistic about what the situation is. And if we do that, we'll get through the storm. And we will make it through this just like we have. If you look at that adversity slide, we've gone through a lot of things. And, a few years from now, we'll look back and say, yeah, that COVID-19 thing, wow, that was kind of crazy, huh? Yeah, we made it through, and here we are on the other side. And I think that's the thing I would challenge you to think about is we will get through this. But how you get through it, how you feel about yourself, how you take care of yourself, how you lead others is really, really important. So with that, we're going to transition to our next section. Really appreciate folks being here and being live with us out there. We're going to turn it over to Robert Hart and to Mike Hulefeld and Leo Swanee and talk about the new abnormal. So I'm really looking forward to hearing about this. So couldn't be 3 better people to present this, right?
Please welcome EVP and Chief Medical Officer Dr. Robert Hart, EVP and Chief Operating Officer Mike Hulefeld, and Senior VP and Chief Academic Officer Dr. Leo Swanee.
All right, well, good morning, everybody. Appreciate everybody getting together today. Kind of a funny title, New Abnormal, and where do we go from here? We are going to speak to directionally where we're going from here. If we had all the answers, it'd be pretty interesting, but obviously the uncertainty we all face is pretty startling right now. And so we're going to talk about directionally our plan. The plan is frankly driven by the learnings over the last 4 months. And Warner talked about some of the things that you all accomplished, whether it was the ICU expansion, the testing capability we now have, everything that was done from a PPE perspective. So not going to revisit each of those accomplishments other than to just say again, a thank you for such a remarkable team effort. In many ways, I think the last 2, 3, 4 months of our organization has been our finest hour. It's been your finest hour. And the results you can see clearly on the stage. And what we'll take forward from this is, okay, so we now have a level of infrastructure and capability we just didn't have 4 months ago. So where do we go from here? And what's our plan going forward from a COVID perspective over the next 6 to 12 months?
So just want to say I like the idea of thinking this as a new abnormal. For a while, everybody's saying, oh, this is the new normal, this is new normal. And Mike and I looked at each other and go, there's nothing normal about this. Trust me, there's nothing normal about this. 4 months ago, did you think you'd all be running around wearing one of these? No. So there's nothing normal about it. But this is the way we look at kind of going forward, is how do we ramp through this abnormal period until, say, next year, maybe Leo can be the soothsayer and tell us when the vaccine's going to be here. But we'll have a while of going through this. But these are the things that we're going to need to be doing to really get things ready, to really bridge us into a more normal period. And this is about really how do we keep everything going? How do we keep everything prevent the next wave? Everybody's ready. How do we get people back to work and keep everybody safe and make sure that we're always creating the message that we have a good, safe environment for people? And then really getting everything back up and running. And that's really where a lot of our focus now. I mean, we're looking at reports every day to look and see what's happening across our system and getting things back up and running. So, but before we jump into that, I want to say what things looked like the last 3 months. This is it. This is it, a roller coaster. And let me just say, at the top of that roller coaster, when you start hitting up against 1,000 of these patients, you really get a sense. I like this picture because it gives you a sense of how quickly things ramped up. I mean, I remember sitting in a meeting thinking, hey, you know, they got that COVID up in New York. And then there was one in the state. And then 2 weeks later, I was wondering, is our life ever going to be normal again? Because it was coming hot and heavy. So you can see we made it to the top and then came down, coming down off of that, things began to slow down a little bit. A lot more awareness about everything that we needed to be doing. Now, I will say this, in the newspaper we're hearing about the cases are coming back up in Louisiana. And you know that there's some states that think this COVID thing is completely overblown. It's something you shouldn't even worry about. I would ask all of those people to come work in our hospitals back in March and April, because that was no fun. It was quite a deal. But the reality is, yes, cases are going up and we have to be aware, and we're going to talk about the things that we have got to keep doing. It's our responsibility to keep doing, to keep people safe. But I want to show you what's changed. Go to the next, yeah, thank you. So what's happened here in a pandemic, a lot of times the high-risk people, in this case, the elderly population, certainly get affected first because we don't know anything about it. We don't know how the thing's transmitted. All of these things happen to really create a lot of problems for that high-risk group. Now, if you look around, you've got people wearing masks. People are more conscious about socially distancing, although there is discussion that, I mean, we've all seen the pictures of the party in the Lake of the Ozarks and at the various bars where people are not wearing masks. A lot of younger people, and I want to talk to that. But as I go around and I look at the 60, 70, 80-year-olds, a lot of them are wearing masks. They're being much more cautious. And that's what you kind of see showing up here in the graph here. If you look back in April, 36% of the patients getting of the positives were actually that higher risk population, patients over the age of 60. If you look now, only about 16% are that older population. It's a big swing now in the younger population because they're at the bars, they're going to parties, they're hanging out, that sort of thing. They're getting it. This is a less risky age group, so they're taking more risk. Now the risk that we run is that then they go home and hug and kiss on their parents who get sick then. But the parents, the older people, again, I say, are usually a little more cautious from when I'm out looking and just watching people. They seem to be taking a little more precautions. But again, the message here is we've still got to be doing the things that we need to do to keep people safe. One of those things is all the testing that we're doing and the availability that we have nowadays. So, Dr. Swanee?
So I want to talk about how Ochsner is partnering with the state to fight COVID and prevent exactly what Robert talked about so we don't end up like we were the last week of March, first week of April. And so we've developed testing teams that are out throughout the state. And there's a big shout out to Dawn Peavy, Sarah Roberts, and Emily Arata. And these teams use IO and Rich Milani's data to know where are the hot spots and where are the blind spots. They meet weekly. They look at areas that are showing a lot of activity, and we go, we better test more in that area so we can inform the state and the contact tracers about how are we going to intervene to get those hot spots cold again. And we also look for areas that we don't know a lot of. There's a decent population there, but we really don't know what's going on there. We better test there so, again, we can inform the state about we need more contact tracing here. We need to get active in that area. And that's a great work done by the team.
We certainly anticipate those testing teams, again, in this new abnormal, to continue to run throughout the course of the year and probably until there's a vaccine, so that, again, we can continue to manage this. We also know we need to continue to invest in our infrastructure. We've talked about the great work that our lab team has done, but that work is not complete. I think people probably know, you may feel this in the clinical areas, our testing volume the past week or two continues to go up. We're now at like a 48-hour turnaround time for a lot of our testing. We're trying to run it closer to 24. So we're making additional investments. There's a whole space project underway. We're bringing in more lab equipment, and we'll have better capability in mid-July to actually do saliva-based testing, which is going to be great from a patient perspective. But that will also significantly expand our capacity too. So we've done great work. It's not finished. We'll continue to invest and continue to expand our capability because, again, we're going to be living with this for a little while.
But I do want to give another shout out to our lab team. Mike mentioned it. That group from the very beginning, within days of realizing that we weren't going to be able to meet the demand by going through the state, man, they were able to get that, bring it in-house, do that work, get the antibody testing, get the ID now, getting another test, another machine to do more testing. They just continue to ramp that up, and they've done a great job of doing that time.
3,000 tests a day now.
Yeah.
It's unbelievable.
And you know, Warner mentioned that our strategic plan is working, and one of the things we have done strategically is really invest in data and analytics, and it's really come to fruition to be able to leverage that against the fight against COVID. So every day in the new abnormal, the exec team looks at all of the data that, to be quite honest, only Ochsner can collect throughout the state to look at activity of COVID throughout the state, again, to inform our decisions. And Warner mentioned Dan Ford and Ebony Price Haywood in our Center of Outcomes Research, who used the University of Pennsylvania model. And then this great team went out and got collaboration from the other health systems. And we get all the data of all the hospitalizations for our region. And we're able to model what is the RT, so that's the spread in the community, what is the bed utilization, what is the ICU utilization, so we can stay in front of this. So it's a lot of great work done by the team, Laura Wilt's team and the data team.
And also along the perspective of infrastructure, whether it's the lab capability, the analytics, the facilities component, our facilities team has just done a fantastic job, whether it's at OMC with the expansion of the tower that will be completed next week, in North Louisiana, the expansion of St. Mary's, as well as the ICU capability at Kings Highway, our supply chain with the PPE stockpiles. we're getting to a 6-month supply of just about all of our major PPE supplies. That's something that again, 4 months ago, we weren't even talking about any of this stuff. So should there be a bump back up, when there's a bump back up, we're gonna be ready. Because the other thing that's in place now, all the twice-a-day phone calls that we had, all those policies, all those procedures, all the Epic workflows that, again, the IT team did a great job. None of it existed 4 months ago. It's all in place now. So if we bump back up, when we bump back up, part of our job is going to be to let people know, our caregivers on the front line, we got the capability to do this. It's fundamentally different than it was 3 or 4 months ago. We're in a very different spot.
Now I want to give an example of what Warner calls auctioneer speed. So if you think back on March 1st, there were 0 COVID trials occurring at Auctioner. We now have 38 COVID clinical trials at Auctioner that have enrolled over 3,000 people. That's Auctioner speed. And so I want to give a big shout out to Sam Bright, the new Dean of Research, Mark Roberts, Julia Garcia-Diaz, and all of the research team for the incredible work they've done. And that is equated to 123 patients getting an experimental therapeutic drug or treatment since COVID started in March. That's incredible work. The other very important thing is we've been able to leverage our partnership with IO and research with Pfizer to get Auctioner to be one of the few vaccine trial sites in the United States. And this is one of the leaders in the vaccine against COVID. We look to enroll patients in our community in August. And it's just another example of the great work that Auctioner is doing through its partnerships. And then last, I'd like to talk a little bit about the pivotal studies that have come out of Auctioner academics that have really informed and advanced our knowledge of this disease. You know, one was published in the New England Journal by Ebony Price Haywood and the Center for Outcomes Research Group that really was the first really good literature about the impact, a disproportionate share that vulnerable communities, like Black communities in our area, were bearing from the COVID-19 disease. And the other one has just been published, and so I now can share some results with you. And this study is really informing our public health response, both locally and throughout the state. And so the prevalence study, which is an incredible endeavor to go, and I give kudos to Warner and his leadership to say, hey, you know, time is of the essence to know this data. We're going to fund it. We're not going to wait for external funders. Auctioner is going to fund it, and we funded this study. Quite honestly, I'm going to say I don't think any other organization in the region could do this because of the logistical tasks that need to take place to do it. And there's a couple of key lessons I want to share with you today. One is we're not near herd immunity. Only about 7.8% of the population in Jefferson and Orleans has been infected. And to get to herd immunity, we need about 60 to 70% of the population, which means that vaccine trial with Pfizer is even more important, because really this ends when we're going to develop an effective vaccine and we vaccinate about 60 to 70% of the population. And the other very important lesson learned from the prevalence study is that there are many people, about 6,000 people on the week of May 15th in Jefferson and Orleans that were infectious, shedding virus with high viral loads in their nasopharynx that had absolutely no idea that they had it. They were completely asymptomatic. And so the importance of wearing our masks, doing the right thing, social distancing, not just at work, but in our home life, is really important for us to beat this virus.
Yeah, and thanks for hitting on that, because really, we have 26,000 people that work in our system. Every one of them are what makes healthcare work for our system and for our patients across the state. So there's a responsibility, I think, for every one of us to do these things and to be promoting these things out in the community, the wearing the mask, washing your hands, keeping the socially distanced, that sort of thing. And if you're sick, stay at home. A lot of these spreader events that we have now, if you get away from the big event in Mardi Gras, a lot of the big events now are people where people went to events not feeling well, but thought they would just go anyway. That's not what we need. We need people being responsible and protecting people. So you got to do these things. The other thing I would say is, Leo, is to make it safe By doing these things, you create a safe environment for everyone around. You build that picture that it is safe and okay for our patients to come around, for our employees. You got to remember, we have a lot of employees that haven't been direct patient care the last 3 months. So some of the information they're getting from news, from TV, that sort of thing, may not be completely accurate. So we've got to keep educating them as more and more people come back to their offices to work. We've got to let them know how it's safe for them. We got to let them know that this is where you stand to be socially distancing. You do have space. We also have to be clear, though, that if I pass Mike in the hallway in 3 seconds, that's a very low risk exposure. We talk about wearing masks. We talk about prolonged exposure, over 20 minutes. Passing him in the hallway is very low exposure. Now, it may not be fun to pass him in the hallway, but it's a low exposure from a COVID standpoint. But you get the message. So let's don't be so paranoid that we're afraid to do anything because of that. But again, wearing your mask, keeping the socially distance, making sure if you're having meetings, we need to continue Zoom meetings. That's why we're doing this here today. We got everybody out there is spaced apart. I don't see anybody out there within 6 feet of anybody. So that's great. We need to keep doing that. We need to keep being cautious like that until we move to the normal again, where we have a vaccine. So Mike's going to take us through some other things that we're doing.
Well, and that plays into the ramp and the recovery. And I know that, especially for our clinic leaders, our outpatient leaders, these are daily conversations. I do want to thank our physician leaders as well, who've really done a great job expanding our physician schedules as we head into the second half of the year, so we can make up for some of the economic shortfall that we've been dealing with for the past few months. We are hopefully arming you with good data, with good analytics, so that you, again, can manage this. Warner talked about point to point. It is day to day, and we are watching these stats and really trying to understand what direction our volume and our business ultimately goes in. But one of the things that I've thought about as it relates to this is we're on a good trend. Warner talked about some of the stats, up to 80, 85, in some instances 90%. Really good momentum. Keep in mind what we're going to need to manage to in a margin world of 2 or 3% margin, which is pretty tight, as you know. We've got to get to 100. People are going to feel busy at 95% again, right? But we're going to have to push all the way to get to 100 to get back to where we need to get from a financial perspective. So that's where the details matter. And again, if you need analytics, if you need help from that perspective, we're here to ensure that you have what you need to continue to help us grow. So that's kind of the thought process, again, around this new abnormal, prevention and readiness. All the environmental stuff and all the investment that we've made from an infrastructure and policy and facility perspective. We feel great about that. The ramp and recovery, again, you guys are off to a great start, and we'll continue to manage those details as we move forward. Before we shift gears and have a discussion around workforce, just one closing thought. I'd ask everybody to take a step back, if you haven't done this already, and really reflect about how you led differently in the past 3 or 4 months, because it was amazing what everybody accomplished. And so when I sat back and thought about this from a personal perspective, there were a couple things that really stood out. I put some notes up there. I've talked to several of our CEOs, some of the same thoughts. I would just highlight a couple. One, personal communication. Warner talked about it in terms of getting with your staff and talking in groups, but it's talking in groups. It's less emails. It's less on the text messaging. It's more human interaction, because when we do that, we just make decisions faster and better. And that's what we saw. And I think the thing that stood out to me over the past 3 months was all about how you all communicated as leaders. You pulled together every single campus, IT, clinical, non-clinical, didn't matter. People communicated. People absolutely nailed it. And so think about that as you move into this new abnormal. How do we communicate differently? How do we communicate more? Because I think that enabled so much of the success and the great care that you all were able to provide. So think about it, a little homework assignment for folks, and with that, we'll turn it over to the workforce folks.
Please welcome to the stage Senior VP Risk Management and Chief HR Officer Tracy Skiro and VP Chief Diversity Officer Deborah Grimes.
It's nice to be here at the abnormal system leadership meeting, since we're talking about the new abnormal. I wanted to take some time this morning to share with you, my excitement that we have Deborah Grimes as part of our team as Chief Diversity Officer. She definitely started during an abnormal time, but we really have some great things to share with you today about our focus on the workforce. And so we want to go ahead and get started and talk a little bit about some things that we kicked off at the system leadership meeting in January. And we talked a lot about a culture assessment and why it was important at Ochsner for us to do a culture assessment, because it really ties back to everything we do and how we get things done around here. And so, at Ochsner, our culture really is about how we build our strategy and our mission and all the things we do that tie back to that. It's shaped by how our leaders behave and communicate. It's about our employees and how they sustain that in the work that they do, and it's reinforced in our operations. So we wanted to take some time back in January to do this measurement to understand what our organization thinks about the culture, so what our employees feel when they're at work. And we did the assessment, and we had over 12,000 respondents, and we also led focus groups and interviews to get some other data besides the objective survey data. So we are really excited about the participation and what we learned. What I will say is that we had this information, and then we were in the middle of COVID, so everything got delayed in terms of our ability to really get out and start talking about it. But I'm so glad to be here today to start sharing some of the early findings as we continue to work on this. So what we do know is that as an organization, we have a very strong culture. Our culture is strong in courage, commitment, inclusion, and shared beliefs. And what you see across the bottom, because I know this is a lot of data, are these core indices. And these core indices is where the focus groups and the interviews really provided us with more detail around where we had strengths and where we have opportunities. And that's where we're going to spend our time over, as we put our strategic plans together, as we put our initiatives together, around where we want to focus to improve the culture at Ochsner. So our strengths is where we want to focus and we want to continue to build upon. We know that our employees think patients are our number one priority. They feel that we're focused on delivering the best care to our patients. Our values are strongly resonate with our employees. They understand and they live by our values. Many of the interview participants and the focus group participants knew our values. They could speak to them. They could give examples of how we live our values every day. So that's embedded deep in our organization. That our employees value teamwork and collaboration, and that Ochsner is transforming healthcare. So there's a lot of comments around innovation and being proud to be part of the innovation that Ochsner brings to our patients and our community. So as I said, we really want to focus on our strengths, which we just went through around our patients are our top priority. We value our values. We demonstrate strong teamwork, and that we have a focus on innovation and transforming healthcare. But we can't talk about our strengths without mentioning that we have some opportunities that we need to work on. And these are some areas of focus that Deb and I are going to spend some time going through as well today around action plans. But we heard from our employees through the survey, through the interviews, and the focus groups that diversity and inclusion is an opportunity, that is not clearly understood, or that there's not a clear strategy around how we address diversity and inclusion in the workplace. Many of our employees feel that they would like to be able to raise issues and concerns, and so there's some comments around empowerment and how do we help our employees feel more comfortable to bring forward issues. We know that in certain roles and facilities, some of our employees feel less recognized than others, so how do we improve around our employee recognition programs? And then decision making can sometimes lead maybe to not being as fast as we would like to. And I would say during COVID, I would wonder if this would change, because we started making a lot of decisions in a different way and moving a lot faster on some things when we kind of took some of the barriers out. So I do think that we're making strides, and as Mike and Warner and others have shared, I think some of the things we learned during COVID will continue and will help us in some of these areas. So one of the areas that was mentioned as an opportunity is diversity and inclusion. And I will let you know that we've been on this journey for a couple of years, but we could definitely do better. So we started out really early on with having a workforce development strategy. Back in 2013 and 2014, we kicked off our first MA Now programs. We kind of built upon that, and we got into the high schools and started doing internships with Youth Force NOLA. We put in the Impact Certification program for our employees. In 2017, when I took over the role, Missy Sparks and I really worked on the Ochsner resource groups, and we launched with 4 groups. We started with our women's group, our African American group, our veterans group, and our LGBTQ group. And today we have over 3,000 employees in those groups. We put in D&I training through NEO and new leader orientation, so our employees hear about our diversity and inclusion efforts. They hear about our auctioneer resource groups when they go through orientation. And we also started LPN apprenticeships to help our MAs that wanted to become LPNs. And then in 2018, we finally, we had worked really hard around the HEI certification, and we changed some benefits, and we put some things in place to achieve 100% to support our LGBTQ patients in our community. We increased minimum wage, and in 2019, we made the decision to move to a culture assessment, which I just shared with you to understand more about what we could do to improve culture and to work on the things that we're strong in. We put in a minority recruitment focus on our fellowship and internships in 2019, and then we expanded all of our workforce programs across all the regions. And so we have more representation around helping those underemployed and unemployed in our communities find careers in healthcare. And then just this year, we offer Deborah Grimes the Chief Diversity Officer position, and she's going to take the strategy that we started, which was really focused on workforce development and making improvements in the workplace, and expanding it even further into what we can do and then how do we sustain it across all areas of the organization, not just for our employees, but for our patients and our community. So I'm going to pass it over to Deb to share our strategic plan for diversity and inclusion.
Thank you, Tracy. So as we move forward, I think it's important for us to think about diversity and inclusion as this vision, and we need to personalize it as what is Ochsner's vision as it relates to diversity and inclusion. This vision was created out of hundreds of interviews from employees, from looking at our patient data, our employee engagement data. And it is in line with industry standards, but it's also in line with our own strategic vision and goal for Ochsner. So our vision statement is really that diversity and inclusion provides synergy that celebrates individual uniquenesses among people, cultures, and structures, that it allows collaboration which empowers the Ochsner team to drive innovation and excellent outcomes through cultural awareness. We focus all of these efforts in key areas that relate back to our core values of patient first, compassion, integrity, excellence, and teamwork. So how are we going to live this vision every day? It's important to think of these core objectives. In the area of care, we're going to provide culturally aware and equitable care. But how are we going to do that? We're going to implement things like Health Disparities Task Force. We're going to look at cultural sensitivity training. We're going to look at outcomes from a demographic perspective. But everything we do has to have metrics to measure our success. So we're going to have metrics like reporting demographic population health data. We're going to track the number of Medicaid and uninsured patients that we're caring for. In the area of leadership, we're going to create a diverse and inclusive leadership. How are we going to do that? We're going to look at our workforce development process. We're going to modify recruitment, promotion, and retention processes. We're going to do bias training, and we're going to enhance our mentoring process. There will be metrics associated with this. We're going to look at recruitment and promotion retention data from a demographic perspective. We're going to track the number of senior leader searches that we do, and looking at diverse candidates, and we're going to track the number of diverse leaders that we have in the organization. We're also going to create an inclusive environment for our patients, employees, patients, and families. How are we going to do that? By listening, by talking to people and hearing about their experiences. We're going to have a more regional Ochsner resource employee groups. We're going to expand that. We're going to do a lot of training in this area as well. There will be metrics associated. We're going to have regional D&I councils. The fourth objective is in the area of supplier diversity. We are going to implement a comprehensive supplier diversity strategy. The way that we're going to do this is to really develop close collaborations with local businesses throughout the organization, and we're going to establish a diverse supplier tracking system. There will be metrics associated with all of that work as well. The fourth objective is in the area of communication. It's really important to create a D&I visibility from an internal and external perspective. Communication is extremely important in this space. If we do all of this work and no one knows about it, we're not going to move the needle. So we will have metrics associated with that objective as well. And then we will have a list of several initiatives that we will implement. I'll highlight a few. So we're going to have targeted recruitment with a focus on diverse candidates. We're going to ensure that we have diverse candidate pool for all of our senior management positions. We're going to modify our talent review process so that we will be selecting diverse leaders that can have this enhanced mentoring program that we talked about. We're also going to have OLI education series. We're going to start with mandatory implicit unconscious bias training for the organization, and there will be several other things that we will implement as well.
So Deborah shared a lot of initiatives that, we'll be working on, and it's obviously a journey. It's not something that we can fix tomorrow. There's lots of things that we can focus on around diversity and inclusion. And in my role as a CHRO, it's my responsibility to help Deborah to operationalize and put these things into place in terms of everything we do that touches our employees, that touches our workforce. And so I wanted to just take a little time this morning just to share a few things that we kind of have on tap right now amongst all the things that we've been doing around workforce development, but some things of how we're going to shift and support the diversity and inclusion strategy from now through the end of the year and then ongoing. I know Deborah talked a lot about the promotion and the recruitment processes, and I will tell you that that is something that we're talking about in terms of kind of putting the plans and how that will work. So I'm sure at one of our next system WebExes, we'll take some time to talk through what that's going to look like and then how we'll all be educated and what standards will be held to around the recruitment process. But that's something that, we're fine-tuning because we want to get it right when we go out with that program for the organization. But what I do want to share is that we have been working on a career center approach. And I know when I started out at the beginning of this year at the system leadership kickoff, I talked about our career center, and we talked about it, being a building and a place where people can come to learn about careers. But right now, considering the current state and not necessarily wanting to create an environment where we're all face-to-face, and we have shifted a lot of our recruitment programs to virtual, we are looking at setting up a virtual career center as a phase one to get started. And it's really with an internal focus to help our employees understand how to navigate the roles that are open at Ochsner and how to navigate a career in healthcare if they want to grow their skill set. So you'll see that this late summer, so probably early August, we'll be kicking off with a web page that would be focused just for our internal, for our employees, for them to access information about getting a career coach, exploring opportunities, what workforce programs are available to them through Ochsner Scholars or through the apprenticeship programs that we have in place. We're going to offer career workshops, helping individuals fill out a resume or having talent talks to learn more about opportunities within the system. And then we are also going to have a stay line, because sometimes we know that sometimes employees are frustrated. They think that maybe this just isn't the right role for them, but it doesn't mean that they have to leave Ochsner. It just means that may not be the right position. And with 26,000 employees, there's lots of other opportunities that we can maybe navigate and help an employee realize that there's something else that would be a really good fit for them. So all of this focuses really on career growth, on retention and recruitment, and helping our employees understand how they can navigate a career at Ochsner, because there's lots of opportunities for everyone. And then the other area that we're going to be focused on is setting up a OLI learning series around diversity and inclusion. So we are in the process now of building out the content and the curriculum for these programs, but you can see that we are going to start with an implicit bias assessment for all of our leadership. There'll be classes as well for our employees, but in terms of kind of getting started, it'll be a OLI-focused program. We'll have classes around bias in healthcare, cultural sensitivity and competency, recruitment and retention of diverse talent, racial equity, courage and vulnerability, and communication, and inclusive leadership experience. So we are working on building these programs out, and they'll be available starting in August, starting out with the implicit bias assessment. And then we're really excited to share that on Monday, Kenneth Polite, who is one of our board members, is offered to do a session for us, and it's just a talk about diversity and inclusion and how our leaders can support their employees during these difficult times. And so he's going to be sharing some viewpoints and some advice about how to have conversations with your employees about racial inequities or just whatever topics that may come up around diversity and inclusion, because we know there's been a lot of listening sessions and a lot of leaders have reached out about how to have these conversations. And so Kenneth has volunteered to do this, and so far what I've seen, there seems to be a lot of interest in people signing up for the program. So we just wanted to remind everybody of that for Monday. And then my ask of you and all of and the executive team's ask of all of our leaders is to embrace inclusivity and champion diversity within your organization, within your own team. And it's important that we check in on our teams. As I mentioned, we've heard from employees in listening sessions. We've heard from leaders that people just want to, be asked how you're doing, how are things going. So just increase rounding, be present, have difficult conversations. It's okay to go in the room and say you don't have the answers or you may not know what to say. I've done that many of times through this whole crisis and recently as well, as going in and having conversations around diversity and inclusion. So it's really about listening and learning and being open to hearing what your employees have to say. And be present and let them know you care. I think is the most important thing, and what we're hearing from our staff is that they just want to hear from their leaders and their peers. So I'll leave you with that, and look forward to working with all of you as we continue to build out our diversity inclusion plan and focus on our workforce strategies. Thank you.
Please welcome Senior VP Consumer Strategy, Jennifer Bollinger.
So obviously, as an organization, we have always been focused on meeting the needs of our patients, and we are also really focused now on understanding their expectations as consumers and working to exceed those. And that's one of the reasons that our experience goals for 2020 will actually not change. And frankly, our teams have done an amazing job throughout the crisis period. We have great momentum. We're on track to meet most of these, if not all. And, in our new abnormal, we have an opportunity to not just deliver great service, but to differentiate on it. And I know we've spent a lot of time today, and you'll hear it over and over again, talking about safety, but we know from our patients that, as they experience the world now, that trust is critical. They have much higher expectations of us and feeling safe in our environment than anywhere else. And it's, all the signage we have in place, the new processes, all of that is fantastic. But really narrating the safety efforts so that they're highly visible, that we're explaining the why throughout an encounter is equally as important, if not more important, in terms of reducing anxiety and making sure we're not scaring people with all the safety measures that we have in place. The other thing when it comes to the inpatient experience, and I don't know if any of you have experienced this, but I have a hard time really reading a situation with masks on. I'd never realized how much information I took in terms of facial expressions and other visual cues that are no longer available to us or to our patients. And so masks on is critical, but we're going to have to think differently about how we welcome, how we demonstrate empathy, and a lot of that is going to come down to over-communicating verbally. Instead of, I'm guilty of smile and nod. Well, no one can tell I'm smiling anymore. They can tell I'm nodding, but maybe they don't know what's going on. So, and really thinking about eye contact and body language, really contributing to the new in-person experience that we want to deliver. We also think about our digital consumer experience, and so again, heroic efforts throughout the crisis period. Barriers came down, a lot of new virtual and digital capabilities that we're certainly optimizing now, and that our patients engaged in, but as they're coming back more and more in person, digital is going to continue to support their relationship with us and their in-person experience. Our MyOchsner users have never been higher, at least 50 to 60,000 new accounts over the term of the crisis. More and more people are using all the features, all the things that we wanted are now happening. So how do we keep that momentum going? We've stood up and are optimizing low-touch arrival options, virtual lobby rounding, things that are important now, but that we will be able to use on an ongoing basis, as well as contactless payment, not just e-pre-check, but tap to pay, and other things that are really important to our patients right now. But we also know that growth is going to continue to be important. And so we've remained focused on our digital front door, making it easier for new patients to get in, established patients to navigate us. And in the next couple months, we're going to stand up an integrated chatbot live chat platform. We already have a chatbot on the website, and it's been a great capability to be able to offer to consumers. But now patients will be able to interact with the bot, transition seamlessly to a live agent, and never actually have to pick up the phone if that's not what they want to do. So they'll be able to interact and transact fully digital, probably by the end of Q3. And that'll be both on the website, and then we'll also bring that capability live in the portal. So I do think that'll help people, especially people who are just coming to us, better understand everything that we have available. And we're constantly refreshing our 3-year digital roadmap. It helps us to stay aligned. We've stood up a lot of things. So we have to develop a vision for where we want to be in 2022. What kind of capabilities do our consumers want? What do we want to be able to offer so that as we work now, we're headed in the right direction? And certainly we want to bring all of that together in a more seamless and integrated experience so that it's easier for the consumer to understand and also make it personalized. Not only when they're not with us, but try to bring some of that personalization and preference into the point of care experience. And finally, as we looked at our strategy for the year and really kicked this off in January, we know that the national competitive landscape is bringing forward a lot of virtual care subscription models. And we didn't have one, but we do have all the components. So we had been working to build one really more from an ease and convenience perspective, but pivoted during COVID, and in a matter of weeks, 50 to 60 people working very hard, we have stood up what we are positioning as a solution for our patients, knowing they're going to lose jobs, knowing they're going to lose benefits, wanting to make sure they're not avoiding care. We have a 3-month, very affordable, virtual first primary care subscription model where they can get care through virtual visits, they get one lab. It's really meant to make sure that they stay connected and bridge them from employment to employment or until they actually have benefits again. And I think for the organization, it's a phenomenal opportunity to learn because we do want to get better at this. And now that we've been able to stand this up, we can develop other models for next generation care delivery. Thank you.
Please welcome back Dr. Robert Hart and Mike Hoolefeld.
All right, well, good morning. Robert and I want to give you a little bit more of an update on our strategy around destination care. And certainly, it's almost hard to reflect back to kickoff. But this was a slide we showed at kickoff around our strategic focus areas, around our destination services and strategies. And what is consistent is the themes. The how is going to evolve and change given where we are today versus where we were 5 months ago. But the regional growth focus and broadening our reach there, the integrated centers of excellence across our health system. We'll talk more about investments we're making there. Quality and safety, Dr. Hart's going to give an update from that perspective on how we're going to refine the plan from that point of view. Continue shifting the delivery model, growing our outpatient services, although I will say the hospitals have never been more important than the last 3 months. And so we talk a lot about outpatient growth, but our hospitals were just so important to the organization and continue to be. And then cost structure and affordability, and this is that concept that Warner talking about. We got to manage the gas pedal and the brake pedal at the same time.
Yeah, I think as you think about the shifting the delivery model, I think what we're referring to here in January was nothing like actually what we saw in March and April. That whole delivery model is not what we want and what we were planning for going forward. So, but we do have there was a lot of learning there though as well. How much can be done virtually? So, we're going to hear later about telemedicine and some of the virtual stuff. A lot of that space we know can be done there, so we want to continue to develop those along the way. So you mentioned safety and quality. So we've been on this journey, and I don't want this COVID thing to sideline all the great work that we've done there. We've done some incredible things, but we are going to have to essentially, let's think of it this way. July 1, we're going to push the reset button a little bit. We had the Elite 8 that we rolled out back in January. We had added a measure on there. We were going to 8 measures. COVID happened. The world changed. And so there's some of the things that, because of COVID, we really just cannot go back in and measure effectively. And certainly when you start doing comparators across the country, we know that some hospitals got spiked, some people didn't. So the data is just going to be completely not good comparator data. So the one thing that we were able to look at is we really think we can take good measures in our hospital-acquired infections. So we are going back from July 1 on. We're going to take half a year's worth of what our goals were on those hospital-acquired infections and set those as our goals to work towards. The other thing that we've added is the post-surgical checklist. This is very important. You know, we do the timeout before surgery. We found out how important that was. It's actually very important after the case as well. This is where a lot of the learning can be done if we take the time to do it. And I would urge all of you, any of you out there listening, take the time to do it, because this is where you learn what went on well, what didn't go well, what did the people around you see that could be done more efficiently as our ORs ramp up. And this is the time to do it. This is the other thing. West Bank did a great job, by the way. OMC did some work on this. While surgery volumes were low, they spent a lot of time thinking about this, about how they could make this work going forward. When the business ramps up and it gets busier and you go, oh, I don't have time for that, you want to embed that. You want to make that a part of it. I want the surgeons, I want everybody in the room saying to each other, look, if you see something that concerns you, speak up. Don't just let it happen. Because as we continue our work towards zero harm, we've got to create the environment that we don't know everything, but we rely on everybody in the room to make it go well. So that's what we've got to have from everybody going forward as we look at this checklist. And what we want to do is get to where the last quarter of the year, 90% of the time, we want to be doing this post-op surgical checklist to make sure what went well, what did we learn, what can we do better.
Yeah, and
Mike?
Tracy talked about culture. And so
Yeah.
this is all about, we've talked for years now about the culture of safety within the organization, and breeding an environment where it's safe for people to raise issue ties in exactly to what we talk about from a cultural perspective, and obviously will drive safety and quality as well. Moving forward again with the regional growth plan, we have dialed back some capital projects, but that doesn't mean we're dialing back all capital projects. And so we continue to look at our footprint around the state and where we want to continue to invest. Some major projects that we will continue to move forward with, the Benson Cancer Center at OMC and the West Tower coming online now for both of those projects. Our Covington Cancer Center, the steel's up out of the ground. That partnership with St. Tammany continues to roll forward. That will open middle of next year. We're really excited about the cancer program and what we're going to be able to do for cancer patients on the North Shore. In North Louisiana, we talked about the investments at St. Mary's from a women and children's perspective, and then the continued growth of the Kings Highway campus as well. So we're excited to continue to invest there. We will build out the Gonzalez Clinic. This was something we had talked about, put on hold. And again, as we continue to evolve the plan and move point to point, we'll make decisions like this one and bring certain projects back online as we continue to grow and ramp up. So I just want to highlight a few of the major ones. We know we'll continue to manage our routine budgets, and everybody's doing a great job of working through that. I would just make one more comment as we talk about our routine capital, which again, I know we've restricted a little bit. If there's a patient safety issue or there's a clinical concern, raise it and we will deal with it. regardless of what our routine capital budget says. We fix safety issues. So as we continue to work through this year, again, things are going to be a little bit tighter than what they have been, but we will not compromise on safety or quality.
Before you leave that slide, I just want to say, more and more people want to come see us. The really great thing is I was just looking as you were presenting this, and as you listened to what Warner presented earlier. Yesterday, what happened? We were out making an arrangement. We have a relationship now with Singing River to the east. We have a relationship with Lafayette General to the west. If you look here, we're making commitments, moving facilities in North Louisiana, the Baton Rouge market, the North Shore market, at OMC, and the New Orleans market. Everywhere we're growing because the demand for our services, people want the quality care that we give. And we're investing in those because what do we want to do? We want to make the people of Louisiana healthier. And we've got to all take that as a responsibility to do. And by doing these things, we can make that happen.
Agreed.
Yep. And it takes the people. It takes the physicians to do it. And this is the other thing. There are a lot of opportunities. We had, before COVID hit, we already had 75 physicians hired with contracts ready to start this year. We didn't call any of them and say, let's think twice about that. We want them coming because we know down the line that demand is going to be there. Sure, we've got some times to get through where we're trying to make sure everybody is busy, business is coming back, but we want those physicians coming to take on the needs that we're going to have down the line. And the great thing is, this is everywhere as well. North Louisiana continues to grow. I tell you, North Shore, the opportunities there that we're hearing coming out of Mississippi, and certainly now after this announcement yesterday, Dr. Riddell and that group just continue to recruit. The Baton Rouge market, we're getting some specialists over there that are looking at Ochsner that 10 years ago never would have considered it. So a lot of opportunity here locally. A lot of people are just saying, wow, this COVID thing, this is a little rough. And y'all seem to have it going on. So they want to be a part of great care. So a lot of good things happening in that space.
And I think those physicians in the community, as well as patients, they need us in the services that we're able to provide. This is an interesting little, if you look at the bottom part of the graph, just an interesting little trend on our transfers. And this goes back again to this regional draw, but more importantly, the patient need and what it is the care you provide means to our people in our community. Our transfer business is already back. It's rolling. Those highest, most complicated things that only we do is such an important part of what we do for our state. And so, great job. I know that this is tough at times to manage all these patients coming in through the Patient Flow Center, but really appreciate all our physicians and clinicians stepping up to making sure that members of our state, people that live here, can get the care that they need. So, with that, we're going to welcome up Dr. David Carmouche and Christy Nichols to give an update on our community health efforts.
Please welcome President, Ochsner Health Network and Senior VP Community Care, Dr. David Carmouche, and System VP Partnerships, Christy Nichols.
Hey, good morning. It's great to be here. I was just told offline that there are 400 of you that we can see playing solitaire right now. So if you would just turn that off and focus back, that would be great. So back in January, Warner made the statement, kind of audacious statement, that we were going to change our name from Ochsner Health System to Ochsner Health. And it really wasn't to de-emphasize system, it was to emphasize health, and that what we want to be about is being a system that delivers health for Louisiana. I think the COVID experience has really suggested that, for a state as sick as ours, it's no surprise that we've had a disproportionate impact of COVID early on. And I think what we want to be about, and what Ochsner is trying to do with this strategy, is to actually extend health into our community. So it's been about expanding urgent care and primary care, our clinical front door. It's evolving the payment models to capitation, because that's really how we get paid when we keep people healthy and we keep them out of our facilities. It's obviously quality and managing unnecessary care. It's also importantly extending care outside of our traditional bricks and mortar into post-acute, into the home, and as Christy will mention in a little while, into underserved communities in a very new and exciting way. And then when we do all that well, employers are really interested in working with us as well, and we can bring solutions to them. So COVID had a big impact on primary care. Obviously, we were shut down for a bit. We're back. 90% of our budgeted volume back, and I think if it weren't for Robert Hart making our physicians take vacation, we'd be back at 100%. But practice doesn't look, right? Right. Practice does, yeah, one night only, David Carmouche here. The practice looks differently, though, because it's a lot of virtual visits now. It used to be 1% of our visits were virtual, now 15%. At its high, it was 70%. And so our providers have done a really, really good job of learning how to deliver care in a very different way. Urgent care was also impacted in a pretty significant way. With the stay-at-home order, people just couldn't get out and get to our urgent care facilities. And so we had them doing virtual visits. We had them doing testing. We made some of those centers testing centers. But they're back now. Now that people are out and about, we've seen record volumes in urgent care over the last 2 weeks. So when people can't get in to see providers, they don't get care. And this is very interesting data from Epic, from all of their national centers, where breast cancer, colon cancer screening, and cervical cancer screenings are just down 90% or more. So people are just not able to get in and get care, and that's really a problem. And so because of that, we have decided not to really relax our ambulatory quality goals. We have chosen to set those goals at the same level as that they were at the end of 19, or in a few cases to actually try to advance ourselves. So still focusing on ambulatory quality over the second half of the year. A couple things that we need you to focus on when it comes to value-based care. We take capitation for Humana and MA, and we get a percentage of the premium, and that premium is determined by the illness burden of our population. And so every year we do about 20,000 HRA visits to get people in and capture HCC codes that really determine the amount of premium that we get. And so we have about 15,000 of those to get done between now and the end of the year, and we'll need all of your support to do that. On the Medicare shared savings, it's about getting these people in to have a primary care visit so they stay attributed to us, and we have about 25% of our Medicare shared savings beneficiaries who need a primary care visit between now and the end of September, and we'll be working with each of you to make sure that happens. Finally, before I turn it over to Christy, in the last few years, we've been trying to extend primary care outside of the clinic through digital, through telemedicine that I mentioned, but also through innovative programs like with Ready Responders. Ready Responders is a startup from New Orleans that uses paramedics to go to the home with telemedicine visits to help patients avoid emergency room visits. And through our work with Medicaid and now with Medicare beneficiaries, we've been able to reduce by 58% non-emergent visits to our EDs. And so we've done a lot to do what Warner said, which was to extend care outside of bricks and mortar into a new way. And I think what Christy Nichols is going to come up and do now is explain a very exciting way that we're actually going to extend care now into underserved communities in Louisiana. So with that, I'll turn it over to Christy and have her tell us some exciting news.
Thank you, David. In addition to the innovative home care strategy that David talked a little bit about, we're going one step further in terms of bringing care closer to where our patients live. In the state of Louisiana, 85% of the entire state is underserved from primary care, dental care, and behavioral health services. And we are excited today to announce Ochsner making an investment in our most medically underserved communities across the state to close that gap. By investing in neighborhood health centers with comprehensive primary care services, behavioral health support, combining that with our innovation and technology for digital medicine, telehealth, and population health, we are going to make a huge difference in our state. Our patients are diverse with unique needs, and they want care close to home delivered by someone that they trust. Ochsner will couple our world-class quality care with our strengths in innovation and research, and combine that with population health, community-based primary care services to improve the health of our patients where they live in their neighborhoods. Throughout the next 3 to 4 years, Ochsner is going to invest in the development of 13 new community health centers across the state. Initially, our rollout will focus on a few key areas, and then we'll build on those areas over time. Those areas include Orleans and Jefferson parishes. We'll also focus on the Shreveport-Bossier area, the North Shore, Lafayette, and Baton Rouge, with the goal of improving the lives of our patients where they live. I'm really excited to announce today that we have sites coming online within the next 6 months. I want to take a minute to recognize a few people that have really been hard at work over the last 2 years to open new sites on the West Bank and also in New Orleans East. We'll be working with our St. Bernard leadership, Kim Keene, to open our first site in the New Orleans East area. This site has been in development for some time. We're working with that leadership team to develop the community health center model for that area. In addition to that, in partnership with a local community nonprofit that we've supported the formation of, we will open a site on the West Bank in Gretna in partnership with Our Care Community Health. Again, I want to make a big shout out or give a big shout out to my team, the System Partnership and Integration team. I have to say that my team has been hard at work on the plan to develop the West Bank Community Health Center and other community health centers across the state for the last 2 years. And specifically, I want to call out Megan Relay and Mary Danute, our leadership on the West Bank, for their tireless commitment to the work that it takes to open this site and to form a new partnership with a new community health center organization. But we're just getting started on the West Bank and on New Orleans East, and we will quickly then move into Baton Rouge. I'm really excited to announce that we will work in partnership with the city of Baton Rouge to open a site close to the airport called Howell Place, and that actual campus is a combination of inpatient, outpatient behavioral health services in partnership with the community health center that will open at that campus. We expect that that site will open somewhere around January, and then we'll continue the development of new sites across the state going forward over the next 2 years. I also want to make mention that we'll be doing this work in partnership with our Health Disparities Task Force that Deborah mentioned earlier. We'll work with the task force and with other leaders across the system to make sure that we are mindful of the unique needs of our communities and what that means in every area that we serve. So again, just truly excited about the opportunity to expand our footprint and to really locate innovative and community-based services where our patients live. Thank you so much.
Please welcome EVP and Chief Administrative Officer Pete November and System Chair Telehealth and Digital Medicine Dr. David Houghton.
Good morning, everybody out there. Dr. Houghton and I are excited to update you on what's going on in digital medicine. We've talked a lot at the last few leadership meetings about accelerating digital medicine and telemedicine. We certainly did not expect a pandemic to be what we were looking for to accelerate that, but nonetheless, it has certainly accelerated digital medicine and telemedicine in the last 4 months. We definitely want to say thank you to everybody throughout the system for breaking down the barriers, embracing digital medicine and telemedicine. And what we have to do now is make sure that we keep growing it and that we keep advancing it.
Right. Well, thanks, Pete, and thanks to all of you for being here today. You know, when we kicked off 2020 for digital medicine, we had an aggressive plan to be able to help grow it for our patients that need it the most, recognizing the benefits that we've seen in both hypertension and diabetes. And we always sort of hang our hat on the terrific results that have been built out of our I.O. shop, and then we've been fortunate enough to be able to carry now to nearly 14,000 more patients. And the reality is that we see that even our patients that come into our program in control, we keep them in control, and the ones that are out of control, we bring them to control at a clip more than 76% of the time for our hypertension, more than 70% of the time for diabetes. But then when COVID hit, we realized that diabetes and hypertension were two of the comorbidities that actually result in a greater course or a more terrible course of the disease. And we recognized, along with what we built with telemedicine to help take care of those patients in the hospital, and now do more than 150,000 virtual visits at home, that we needed to not put on the brakes but really hit the accelerator for digital medicine. So I'm proud that we've had more than 42% growth overall in that program in just the short time since January. We've seen a doubling in the number of our patients that have come through our employer group. We know that within our own family, we've had more than 30% growth with our own Ochsner employees. And then maybe something we're most proud of is the way that we've been able to reach patients in a more rural environment, with now more than an 89% increase of the patients that have been enrolled across those rural zip codes within our state. And I think that's only part of the story with what we're telling about how we're able to reach more underrepresented and underserved patients. Now Pete's going to talk to you a little bit about what we've done with Medicaid.
Yeah, thanks, Dr. Houghton. As Kirsty just talked about, as a system, we are committed to expanding access to underserved patients, and we're going to do that in digital medicine as well. In May, we just implemented a 1,000-patient pilot in the Medicaid space. We're going to do that in Houma and in North Louisiana. And we think this is really important for a couple reasons. One is the patients need it, and two, we need to prove to the state, we need to prove to the payers that digital medicine is the way that we can better care for these patients. And so we're excited about this pilot, and what we need from all of you is to get patients signed up in Houma and North Louisiana so we can take better care of them and ultimately get access to digital care to everybody in the Medicaid space.
So recognizing, as we've done with our Medicaid patient opportunity and with some of the funding that we'd received from the FCC to help cover the cost there, it's really important to recognize that the Medicare coverage has also expanded to take care of remote patient monitoring in digital medicine. In fact, this was expanding even prior to the COVID pandemic. And if you think about what this impact is, there'll be more than 75,000 patients of growth in our community over age 65 in the next 10 years. That means that every baby boomer that is a potential patient of ours will be in the Medicare patient population within a decade. And so to remove that barrier for them so that we can now, as a healthcare organization, receive reimbursement for those patients is enormous. It means that also right now during the pandemic, and we're working very hard with our government partners to try to see that we can extend these different co-payment waivers, but right now there's a zero cost obligation to any of the patients as well. We realize that improving access for these patients is critical. And if you also look about who it's going to impact the most, we know that across our community, 40% of patients, for instance, have hypertension, but 80% of patients over the age of 65, that's twice as many, 80% of patients over the age of 65 also have poorly controlled or have hypertension, sometimes 10 to 20% of which is poorly controlled. So this is a unique opportunity for us to continue to grow. Another unique opportunity that many of you may be aware of was a deal that we inked with the company Hims & Hers just about 6 months ago. At the end of December of 2019, a lot of the work that had been done by Rich Milani, Amy Quirk, and the IO group, as well as what we're developing to produce it on the digital medicine side, was designed to be able to reach our patients in a different way. So to reach our consumers through a company like Hims & Hers, which is a 100% digital, consumer-focused healthcare organization that tries to reach patients often for sensitive medical issues like hair loss and erectile dysfunction. They realize that chronic diseases affects those patients potentially even more than the general population, and that we had a unique opportunity to grow and build what we were offering in our digital medicine programs to those patients specifically. So we've launched this now. We're learning from it in the phase right now across a couple of states. We're in Louisiana, Mississippi, and Florida, soon to expand to Alabama and Texas. And really this is our base for understanding how we can reach more and more patients direct to consumer with our digital medicine products.
And now we're looking at the next wave of digital medicine programs. Dr. Milani, Amy Quirk, Jonathan Wilt, they're always thinking about what's next. And what's coming next is a digital monitoring program in the home. We know that 90% of all seniors want to stay at home, and we know all of those seniors have children, grandchildren, other family members who care deeply about their safety and their care. And so what they've developed is a system where there are monitors throughout the home, in the refrigerator, at the coffee pot, and so they can determine whether, mom or grandma is getting up and going and getting coffee when they normally need to, or going to the refrigerator, and that data will flow back to them in an app, and they'll be able to figure out whether, mom or grandma or grandpa is doing what they normally do and be able to monitor them. I will say that we've learned, personally, I've learned the importance of this during COVID. I have a 78-year-old mother-in-law who has been really the focus of our family to make sure she's taken care of during COVID. There were a lot of days where she was home alone at her house, and the only people that she saw is when one of our family members went over to see her. We would have loved to have had this kind of monitoring system for her to make sure that she was okay throughout the day. So we're excited about where this is going, and this will roll out this fall to our patients, and just another great innovation and project by the IO team.
I heard mentioned earlier about Ochsner Speed, and I think this is a great example of Ochsner Speed, what's been built with our COVID-19 home monitoring programs. It's also a great example of Ochsner collaboration because it's utilized our teams from IO, from IS, from Pop Health, Mark Green's team with the work that they've been doing, as well as our clinical pharmacy team with Ricky Indovina and Ricca Ravina. This thing was put together literally within days to weeks of the onset of the pandemic, and now we've developed 3 separate programs that work interchangeably for home symptom monitoring, for those post-procedural checks for patients that have come into our institution over the last few weeks, doing it under the safest of circumstances, and a surveillance program that links in all of their data that can be available, such as their pulse or oxygen saturations, to really measure how they're doing. It's another remarkable bill that we're really proud to have been able to roll out. And similarly to what Pete was talking about with our home monitoring programs, it's programs like this that will be added into it to potentially be able to learn and grow from what's going to be able to help our patients going forward. And so everything that we do is designed to put our patients first. And we know that as we're able to help improve their chronic diseases at home, that actually puts the community first. And then for our providers to be able to utilize these programs, sign patients up, augment and complement the care that they're doing, along with all of the other forward-facing virtual visits that they've done in this new abnormal that we're all dealing with, well, more than anything else, that really keeps our people most healthy. And so my ask of all of you, just as I do every day, is to continue to sign patients up, to get involved with these digital medicine programs, to see how we can continue to grow, take care of more lives, and really continue to impact our community. So thanks for the time here today.
Please welcome back Warner Thomas.
Okay. Well, we're getting down to the last section here, and we wanted to talk to you about just our diversification and where we're going with that. I'm going to let Pete talk in a minute about Lafayette General, but just the whole focus here is how do we continue to build a statewide presence and over time really a broader Gulf South presence. You can see, the past couple of years with the extension into North Louisiana with Shreveport and Monroe, that's really fundamentally changed Ochsner. The Ochsner Health Network, which David Carmouche leads across the state from a contracting and insurance perspective, has really helped us to kind of think about how we get into different areas from an insurance network perspective. And certainly the most recent news about last night, the final approval from Lafayette General Membership Corp to join Ochsner is a huge step towards solidifying our statewide presence. So I'm going to turn it over to Pete to talk a little bit about Lafayette General.
Thanks, Warner. As Warner said, we were in Lafayette last night and had a really exciting night. I want to say we're looking forward to having everybody at Lafayette General as part of the Ochsner family. Just a reminder, they've got 7 owned and managed hospitals, and like us, they seem to add a new hospital to that list every day, so that could even be outdated. They take care of about 300,000 unique patients a year, and they are known nationally for their patient experience and service excellence. We have been asked a couple of times during COVID-19, does this change your thinking about doing this partnership with Lafayette General? And the answer is no. It actually made our resolve to do this even stronger. We have certainly seen during COVID that we've learned from one another, and I think we can continue to do that. And also over the last couple of months, working with the legislative session, we've realized the power of Ochsner and Lafayette General working together. And so we know that we will be a stronger state, and then we can move the state forward through this partnership. Where we are today is we have signed the agreement. Last night we had the membership vote, so there's really only 2 steps left to get this finished. One is the Attorney General approval, which will happen in the next month or 2. And then finally the closing, which we think will happen on September 30th or October 1st. And then this will be completed. And so we're going to do a lot of planning over the next couple of months with the Lafayette General team to make sure that we have a successful start this fall.
Just a comment on Lafayette General. I just want to give a big shout out to David Calicott, the CEO of Lafayette General Health. You know, he really worked tirelessly to kind of get this partnership put together with Ochsner. It takes a lot of courage, frankly, to do this. You know, your organization out there, you're really successful, you're doing a great job, and then, you know, you're kind of leading your organization, you know, to join up with another organization like Ochsner. And that's hard to do. It's, you know, frankly, you know, there's not always, everybody kind of comes along, there's detractors, and David did a good job really working with his medical staff, with his board, and certainly with the community, getting Lafayette General to where it is today and where we are together. So I just want to give David a big personal thank you and a huge shout out for just doing an amazing job. Let's give him a round of applause. I do want to also cover in a little more detail Singing River Health System, certainly the extension in a broader way into the Mississippi Gulf Coast is a big move for Ochsner. You know, if you look at Singing River, they have about 2,600 employees, about $350 million in revenue, about 80 employed physicians. So a very successful, a very significant organization. With the addition of Garden Park, probably closer to a $400 million entity, and really covering you know, the major markets across the Mississippi Gulf Coast. We're excited about the partnership. Lee Bond, their CEO, has done a good job there. We had a great day there yesterday with their employees, doing Zoom meetings with their employees, with the physicians, and Robert Hart and Tim Riddell. Mark Muller did a great job with the physicians and the board yesterday afternoon, kind of talking to them about the opportunity. So this is a strategic partnership agreement. We will focus on how we can extend and improve care in the Mississippi Gulf Coast together, how we can build on centers of excellence that Singing River has built over time to strengthen their position in that marketplace. Things like our phase 1 trials, you know, other outreach clinics we can bring there. Pediatric subspecialties is usually a really interesting opportunity to bring to new markets. And certainly we want to look at integration of our information technology systems over time to figure out how we can do that in a more coordinated fashion and share information across our entire system. So very excited about that opportunity. We'll begin in July to do more formal planning with Singing River and with their team and really craft a plan for the rest of the year and into 2021. So with that, we are coming to the end of our first virtual system leadership meeting. So first of all, we have some prizes, I think. So we will give prizes away first. Do we have any fancy music? Or we got fancy music. It's all good. So here we go. So if you're in person, this would be all of you folks right here. You can pick up your gift at the exit. So there you go. If you're not in person and you're out there, we're going to mail your gift to you, to your work location. So stay tuned, it's coming. Or maybe Robert Hart will actually drive out and personally deliver it to you. I mean, that would be a really nice thing. If he was a really nice chief medical officer, he would do that. He would personally drive out and give you the 26-ounce Yeti Rambler water bottle, which is going to go to Kim Brown at OMC The Grove up in Baton Rouge. So Kim, congratulations. Robert will be jumping in his car any minute now. Sandra Allen at Dickory and Health Information Management, you've got a $25 gift card to Ruth Chris. Go get a steak. You'll notice as we're going through this, we're not giving out any tickets. Sorry, we don't have any right now. So, I don't know when we're going to get them. Robert, when are we going to have football, Robert? Yes or no? We will have football in some form. How about that? All right, so we'll give tickets away next time, right? Yes. That would be exciting to have Hoofeld and Hart playing football. Whatever. All right, another $25 gift card, Ruth Chris, Holly Guillory at OMC West Bank. So Holly, congrats. Another $25 gift card, Ruth Chris, Heather Pattison, an IO health coach. So congratulations, Heather. I gotta see this 26-ounce Yeti Rambler water bottle. They sound like they're pretty nice. Rob Cusimano at OH Covington. Oh, I gotta, hold on. Look at this thing. That is a water bottle right there. Not only is it a water bottle, you could hurt somebody with this. Seriously, like, I might have to bring this to my meetings with Hart. You know, just it's like a knuckle cracker right here, Robert, if we don't kind of, you know what I'm saying? Yeah. And look at the color. It's beautiful. There we go. Yeti Rambler, 26 ounces. Okay, $25 gift card to Kimberly Root at Baptist. Kimberly, where are you? Oh, yeah. We gotta see if we can get you a Yeti Rambler. I mean, come on. You got one? Oh, you don't need ours. Okay. You're already there. Way ahead of us. Yeah. But look at this color, though. I mean, that's nice. That's nice. I don't even know what color that is. It's very pretty, though. Yeah. A Michael Thomas autographed football. Really? Robert Hart. Now, just kidding. Aaron Snow from Baptist. Aaron, you have got the Michael Thomas autographed football. The $100 million man. Yes. All right, 26-ounce Yeti Rambler water bottle. Emily Larson. Or Emil. Emil, I'm sorry. Emil, where's Emil? Emil, I'm sorry. If I had glasses on, but I'm too vain to wear them when I'm on the video. You know what I'm saying? So, all right. And then Amanda Thompson from Baptist. I'm talking one of these right here. 26 ounce Yeti Rambler water bottle. Bianca, I know I got 5 minutes. I'm fine. You gonna give me the gong here? Is that what's going on? We're like on time. We're like on time here. And then the Alvin Kamara autographed jersey. Alvin Kamara autographed jersey. Robert, you didn't get it. Sorry. Yeah. Bridget Baggert from Neurology. Bridget, congratulations. Those are the gifts. Robert, catch. Nah, I'm just kidding. Here we go. Okay, so we're going to wrap up. So David Carmouche mentioned this earlier, that we set this aspiration to improve the health of the state, this 2030 aspiration. Now, when we started this in January, we didn't know we were going to have a little curveball thrown at us 60 or 90 days later. So we've kind of pushed our way through COVID, and we'll continue to push our way through it. But the reality is that our aspiration is not changing. I mean, we want to focus on improving the health of the state. It's why our merger with Lafayette General is so important. It's why our partnership with LSU in the northern part of the state is so important, because we want to lift up the health of the state of Louisiana. And if you look at our ability to extend into Mississippi with Singing River and with Rush Health System, how we can improve the state of Mississippi as well. So this is about how we focus more on helping people live healthier, more productive lives. Now, we're in times of uncertainty. And I think the question now is, how do you figure out where do you go? How do you figure out what the future is going to be? And this is where I think things like, the best way to predict it is to create it. We have to create our own future. We have to set that vision. We have to adapt to what's happening around us. You heard today from Christy, we're taking a big step forward to lift up the health of the state with these community health centers that we're going to do in a number of different locations across the state. That's a huge, huge step forward. It's just one. We got a lot of other things going on. We're going to be a more diverse and inclusive organization. You heard about the plan that Deborah went through, and you'll see us really drive that forward through the entire organization. We'll have measurable results that we'll show you. We're going to continue on our strategy to be a destination center across the entire Gulf South and to build on our centers of excellence. And you'll see us continue to diversify. And our digital medicine program, I think when we're here a year from now, not only will we be larger, we'll be in more states than we ever could have anticipated, because I think we have more and more opportunities that are starting to be afforded to us as we show the great results of how we're able to control hypertension and diabetes. And as you'll see, how we're able to connect with the home in the future. But I leave you with what we started with, is that when you go through these uncertain times, you've got to be resilient. Perseverance is the key. Resilience is the key. It is about how you manage yourself. It is about how you prioritize and take some risk. You will make mistakes. It's so funny. Every single partnership we do, one of the last presentations I do to the board, as I stand up there and we're kind of, we're all excited, everybody's excited, and I guarantee them one thing. I say, I'm going to guarantee you one thing. We will make mistakes as we go through this partnership. And they're kind of like, okay. But I said, and we'll fix them. If we make a mistake, we're going to admit to it and we're going to fix it. So I think the thing we have to understand, we will all make mistakes. This year, next year, the year after, I could sit here and spend the rest of the day telling you about my mistakes. The reality is that you live up to it, you fix it, and you move on. And you've got to take some risks. You've got to be willing to put yourself out there. Because otherwise, number one, life's boring. And number two, you can't get anything done if you don't try to push forward. This idea of communicating, please, going back to Mike's point he brought up before, emails, texts, just pick up the phone and call people. Or use Zoom. I just find, frankly, I find FaceTime and Zoom is so much better than even a phone call. Even when I'm just kind of, talking to some of my team members, I just like doing it via FaceTime. It has a different connection, quite frankly. And I think that's, in times like this, the connection is really important. So, try to evolve away from email as much. Try to evolve to more connectivity, more kind of real talking to people, and more video connectivity. Because frankly, I think we'll be a better organization. I think you'll be a better leader, and I think you'll connect with the people around you better. And finally, we will make it through this. We've got to be optimistic about that. Look, I'm a realist about the situation and the gravity of it. I know this is a very difficult situation, but I also know that we have been through very difficult times, and we will get through this as well. When you go through, and I think in April, was it April? Yeah, I think April we lost $100 million for the month. $100 million, that's hard to do, actually. I mean, you got to work at losing $100 million in a month, But we did it, So we got through that, and I think in May, it got down to like 30 million or 32 million. So I don't kind of discount the gravity of that situation. But I also understand we got federal funding, we've got a good plan going forward, we got to work together, and that's behind us. We got to focus on what's in front of us and how we're going to make July better, and August better, and September better, and keep getting better, getting ready for 2021. And that's what I would challenge you guys to think about. This idea, the will to persevere, is often the difference between failure and success. I would say it is the difference between failure and success. Your ability to persevere and push through, your ability to not give up, your ability to keep motivating the people around you, challenging them to do their best, and for you to do your best. And look, I understand you're going to have bad days. We all have bad days. You're going to have days when you're not on your A game, I think the best thing is to acknowledge it, try to recharge, and come back the next day. Do your best that day, push through it, share with a colleague, get a support system around you. This is one of the things that Frances Fry's talked about, kind of her personal board, her people that she connects with, which I think is really important to have, people that are in your court, people that will kind of pump you up, and people that you can connect with and you can help as well. When you're going through times like this, the key is do not isolate and do not think that you're alone. That's the time that when you're down and that sort of thing, you actually want to isolate. Oh, I don't want to be around people. I don't want to talk to folks. That's actually when you need to talk to people. That's when you need to be around folks. So I would challenge you to put yourself out there, connect with other people, be the leader that you know you can be, and understand that and I've said this before, in tough times, which is what we're in right now, real leaders lead. The people that work for you need you. Our organization needs you. Our community needs Ochsner, and they need us to lead. We can't get frustrated at what happens. We have to change it. We can't get frustrated that people don't wear masks and don't social distance. We got to communicate, 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 and help people understand why it's important. And if we do that, we'll make a difference in the communities, and we'll be a successful organization, and we'll take great care of people and each other. So thanks for being with us today. We'll talk to you soon. We're going to be back in an hour, I believe, for the System Leadership Awards, Spirit of Leadership. So we'll see you in an hour. Thank you.